Hello, this is Real Talk on Family and Mental Health, and I am Olufolake and Niki. Today I'll be talking on the topic schizophrenia. What is schizophrenia? A lot of people have defined it in different ways, but I just want to talk about it in the DSM-5 way. Schizophrenia is actually a mental disorder which is characterized by hallucinations, delusions, incoherent speech, disorganized behavior, and withdrawal. The onset of schizophrenia affects interpersonal relationship, occupational functioning, and academic performances. The earlier schizophrenia is treated, the better. Today, I have with me a guest who will be throwing more lights on this topic, schizophrenia. Don't go away. I'll be with you shortly. Thank you very much for at least granting me this audience. I just wanted to talk about yourself maybe in 5 sentences. If somebody asks you, so who is Niki, what would you say?
Oh gosh. Who is Niki? I am a mom, sister, a daughter. I'm an American. I've lived here all my life, but spent a lot of time in growing up in Canada. I have a lot of family. I'm multicultural, so I have a varied background, primarily Hispanic, but also European American. I think anything else about myself. I've worked as a scientist for 12 years and then transitioned into psychology, and before I was in microbiology. So love the sciences, but this way I get to work with people also.
All right.
So it's nice.
Yeah. So why did you decide marriage and family therapy of all programs?
Yeah, that's a good question. I actually did a lot of research when I was looking into transitioning and just in mental health in general. And when I found of all of the different orientations or like practices of therapy, that marriage and family therapy really fit not only my beliefs, but when I was looking at the research, it really was the best one that addressed the biopsychosocial systemic model, which is that who we are as individuals, we're affected by everything, by our genes, by the environment that we're living in, by how we're raised, and the systems around us, how those influence the person that we are, and how those influence mental diagnoses, also mental health diagnoses.
So definitely there must have been a story behind you now wanting to kind of delve deeply into mental health.
Yeah, so some personal experiences in my family. Yeah, so I chose this for not only for personal reasons of seeing mental health needs in my family, but also in the community around me. So my passion is to work with people, underprivileged populations, particularly those that are indigent or imprisoned. So I noticed from working with those populations that there was very low access to resources and mental health care. And a lot of times it really worsened the prognosis for people. So that became my passion. I wanted to get into that and really help people on the front lines.
Okay. You talk a lot about schizophrenia in class, and I discovered that a lot of people don't really know what it's all about. Where I come from, it's like a taboo to have stuff like that in a family. So how do you know if a child is schizophrenic?
Of a child. So it's really hard. It actually takes a couple months to really diagnose. If you're using the DSM-5, schizophrenia usually doesn't appear until early adulthood. So you can have signs of it, but it's very rare.
Like what signs? What kind of signs?
So when you're, usually it's early adulthood that it happens. So a little bit earlier for males than females typically. But what you'll look for, it'll be slow changes in their behavior. So they might change the way that they interact with the people around them. and maybe the person that you thought you knew has started to change in a way that they are less social, more withdrawn. They might be doing things that seem very different from normal interactions with people. And then, of course, the main symptoms that come up are delusions and hallucinations. So those can be things that they're seeing or hearing that no one else can see or hear. And so they might be responding to those hallucinations, and it seems will seem very out of the ordinary and almost frightening sometimes to other people. And for the person going through it, it's also a very scary thing. And sometimes they might not even know that they're having hallucinations or delusions, because it's very real.
To them.
Yes.
Okay, so what would you advise, like family members who notice these changes? What do you think should be the first step?
Well, first of all, if you're noticing, or if the family member is noticing that it's a problem for their life. So a lot of times it can present as looking like depression or another like mood disorder. But if they're having problems in their life, if they're finding that it's a problem, because schizophrenia-like symptoms aren't always a problem. In certain countries or communities, having delusions or hallucinations can actually be revered.
Okay.
So it depends on how it's manifesting for you and your family. But if you're noticing it, and if it is a problem that is really scaring you, building a collaborative care team is crucial. So getting in with a psychiatrist. So really what's key in responding, the research has shown that the faster that you can respond to the first episode, so typically when the family first notices it is what is termed as like an episode. So they will just seem to be having a complete maybe breakdown or kind of freak out that's very atypical from their normal behavior.
Okay.
Very scared, maybe sometimes physically manifesting.
How does it manifest physically?
It can be different for anyone. Sometimes it can be maybe violent, sometimes it can be very scared, sometimes it can just be very withdrawn. But these first episodes are very important that you seek help immediately, because prognosis shows that, or research shows that prognosis will be a lot better the faster that you respond.
Is it chronic?
So it is chronic for most people. It's in the United States population, about 0.2 to 0.5% of the population, so not a lot of people. And compared to other disorders, but it is lifelong most of the time. And if you can respond faster, the prognosis of this illness will be a lot better.
Okay.
So what that includes, if you're looking for a response, is building a good collaborative care team and having a strong supportive family system are really the two most important things in the prognosis of this diagnosis. So having your family behind you is huge when they look at factors in family life. So it's not caused by family. It's one of the most genetically heritable mental health diagnoses. But there's also factors in the family that you as family members can do that will help your family member out so much. So unconditional positive regard, they found that that's really helpful. Criticism, especially parental criticism, can really worsen a person's prognosis. So really making that family member feel loved and accepted. They're going through a very hard time, and building that support system around them is so crucial. Also, they've found that families in high expressed emotion, which is kind of a family that's very critical but also all up in your business and very controlling, can make a prognosis a lot worse. So being there and being supportive, but allowing that person to kind of helping them and empowering them to make decisions also for their own life, and feeling good in those decisions in this scary time can be very helpful. The second part of best treating this illness is building a team, not just of the family, but of your healthcare providers. And also any other aspect of your life that's important to you and important to the diagnosed individual. So, for instance, you want to have a psychiatrist almost always.
On the team?
Yes, on your
Okay.
collaborative care team. So make sure you find a psychiatrist, and it's very important that you like and trust this person. That you feel good about the decisions that they're making with you, and going through. They're the person that's going to a lot of times be prescribing some necessary medications, which would be antipsychotics, sometimes antidepressants or anti-anxiety, because those are the two most common comorbid diagnoses. So really getting them to help build the right medication regimen when necessary, and having someone who is very competent in those medications, so they're not prescribing things that are harmful to the clients, because a lot of those medications can have some very scary side effects. So avoiding that if at all possible, is extremely important.
Who else should be on the team?
Yes, so your regular primary care physician should be on the team. Also, just to keep track of what these medications are doing to your body. And there's also a lot of somatic symptoms that can develop sometimes. So a lot of these medications also have secondary reactions like diabetes sometimes, so it's very important to have your primary care physician be keeping track of that and making sure that you're not developing other diseases that are going to make it much more difficult for your prognosis. Also on the care team should be a therapist. So an individual therapy is great, but also a marriage and family therapist is extremely important, because research has shown that family therapy is the best treatment for schizophrenia. So having your family come in for treatment sessions is extremely helpful. And then if faith is important to you, then whatever your faith is, having someone in your collaborative care team who is a huge proponent of your faith and will help you and your family through that, and to incorporate faith into your treatment. If that's an option to you, that sounds good, then having that person in your collaborative care team is important as
So
well.
the collaborative care team, they necessarily don't need to meet together? Must they know each other? Do they have to come together to meet with you, or you meet them individually?
So if you can, you meet with them individually, but what I would suggest is finding one person on that team out of all those healthcare professionals that you trust the most, that you feel is the most knowledgeable, and ask them if they will be the hub of that team. And they should be in contact with the other members on the team. So all the team members should know that they are on a collaborative care team, and that these are the other healthcare providers on that team. And if it's applicable, they might need to have you sign forms that allow them to speak to each other.
Okay.
But if they can work together and keep each other up to date on what's going on with you and your diagnoses and your family, then that will really help the prognosis of that person.
Thank you so much, Niki.
A lot of information.
Yeah, I love it. And Nigeria needs it, really, because I've not seen anybody say, oh, I have a schizophrenia patient in my house. I don't think anybody will want to declare that openly, but if they get to know that people have it, and people can manage it, actually, it'll be a lot of relief to a lot of family members to come out and seek help. And I'm sure that what you've said now is going to help a lot of people. Thank you very much.